I'm Dr. Louis Chang. My area of focus is spine surgery, and in particular, minimally invasive approaches to the spine. Minimally invasive spine surgery means more than just small incisions. It's a philosophy in which we try to achieve everything in traditional open spine surgery without removing extraneous tissue or detaching, devitalizing, or injuring surrounding tissue that we don't need to do. I became interested in minimally invasive spine surgery early on in my career when I started using it in select cases, and I noticed how much better it was for my patients in terms of postoperative pain, rate of recovery, rate of return back to normal activities, among other benefits when compared to my traditional open spine surgery patients. This passion ultimately led me to New York, where I completed a fellowship in minimally invasive spine surgery so I could be at the forefront in this field. There are two aspects of research that I'm interested in. One is clinical outcomes research, which will better guide us in the best way of approaching a particular spine problem with what we know today. And the other aspect is to keep advancing minimally invasive techniques and technologies. I believe every patient is different, and every patient that comes into my office will be treated as individuals. Even if two patients come in with identical problems and identical imaging studies, the condition could affect the patients in totally different ways, or one could be further along in conservative management than the other, or they could have completely different and contrasting occupations. And all these will need to be considered when discussing management options and even potentially postoperative care. But regardless of what spine issue the patient comes in with, every patient can expect the same thing at their appointment, which is a very thorough conversation where I try to understand the condition as much as I can, and we'll also delve into some relevant background. We'll go over your imaging studies in depth and also relevant tests, and we'll come up with a management plan and potentially treatment options. I'm very conservative when it comes to offering surgery, and I almost always work with other specialists in a multidisciplinary way to approach your spine problem non-surgically when appropriate and possible. I'm Dr. Louis Chang, and it would be a privilege to be part of your spine care team.